In Oldham, the prevalence rate of asthma is really high, so we get lots of admissions for young patients with asthma, and with that it kind of comes with that they're not able to go to school, and therefore it has an impact on their education, but also on their family life as well. The InHIP pilot is a project that we've put together to tackle health inequalities and reducing hospital admissions by primarily focusing on smoking cessation. We've been the pilot site for the project, so we've had the patient on the unit who we have monitored their pheno, then provided with some smoking cessation advice and refer them on to external services to continue that support. That may be through the Smoke-Free app, or it may be through kind of local services within Oldham, who can then continue with that smoking cessation.
Asthma runs in my family and I manage my symptoms with inhalers. I also work as an advisor on the Smoke-Free app, delivering stop smoking support to people all across the world. Having that awareness of how damaging smoking can be and how it can impact your asthma symptoms is beneficial, because for the asthma sufferer, they're aware of what they need to avoid, and for the parents it's useful to be aware that actually that second-hand smoke is damaging.
My involvement was running the actual focus groups, and every single focus group was completely different. The age ranges, the different cultures. People can't take the information in necessarily when the child is really poorly, because they've got other things on their mind. They want that education at a different point, so not necessarily when their child's been taken into hospital. They get that message from us and they get to know everything that they need to be able to manage their child's condition.
I was diagnosed with asthma since I was a little baby. From a young age, I was always attending doctor's appointments nearly every single week. It's important that parents are educated on this particular topic, because without this education, these resources, they're not know what they're going to do. And if their child end up coming on a ventilator, they're going to realise we need to take this a little bit more serious, otherwise it could end up in a more worst case scenario.
What we've found from doing the pilot is parents have been educated in what smoking does to children who have asthma, and the effects that might have on their asthma. So by providing them with the smoking cessation advice, we have had some parents who've quit, and we know that because we followed them up in the community with our specialist nurses. From my experience, I do feel like it has had an impact on the ward in kind of the number of admissions, or at least the length of admissions that patients have had when they've been admitted with asthma.
Having the pilot thing and getting these organisations in the community involved is going to tackle the issue a lot more effectively, especially with the times we're in right now. The information you're going to give it could potentially save your life.